Okay. So I want to give a special thank you to the health department for extending this opportunity to me to speak on the topic periodontal disease. And I'm happy for the opportunity to do so because oftentimes our topics are focused on our body and we forget or we neglect to include our teeth as part of that. So it's very important that we think of our body as a whole and we include our teeth in that. So the topic says the theme is you and your health. So I think that that's very important. And I'm glad that that oral health has been a part of it. A lot of times my dad is like, when you know it's just a small area, why is there so much involved, or how is there so much involved? But it just shows how amazing God is, because every part of our body was intricately made and so many small details. Even one tooth has a lot of details to it. And even with dentistry alone, even after the 4 years of dental school, you can go on for an additional 3 to 4 years specializing in a certain, just one specific area in dentistry. And there's so many more. You go additional 3 or 4 years, or even some 6 years. So there's a lot that has to do with dentistry, and something that we should take very serious as we focus on the rest of our body, that we also focus on our oral health too. So today I'm going to be focusing just on periodontal disease, and it's one of the first steps when it comes to taking care of your teeth. So let us pray. Dear Heavenly Father, we want to thank you for the opportunity to come together as a church to learn about our body, learn about the intricate ways that you've created us and all the details that have gone into it. We thank you so much for creating us in such a way and allowing us to be able to study it and understand it in such detail, and that we can use it to make some changes in our lives. So I just ask that you be with me as I speak today. I ask that the audience is able to understand the message that's given to them, and that at the end, they'll be able to use it, open their mind, open their eyes to their oral health, and use it to make life changes. We thank you. In your holy name I pray. Amen.
Amen.
So if you can give me 1 second, I just want to fix something here with my computer. I'm going to stop sharing for a second. Are you able to see my slides?
No.
Okay, can you see now?
Yeah.
Okay. Okay. So today we're going to cover on the topics periodontal disease. We'll go over what is periodontal disease, the stages of periodontal disease, how the effects of it, and some of the things we'll focus on: gum recession, missing teeth, and the prevention of it. And then also we'll discuss other topics in terms of what to do if you've ended up missing teeth, or some of your teeth have come out. What are some of the options to replace it? Are you still seeing speaker notes?
Yeah, we are.
Okay, 1 second. Sorry about that. Okay, it should be better now.
It is?
Okay. So what exactly is periodontal disease? When we break down the word perio means around, and then odont means the tooth. So when it comes to periodontal disease, we're talking about the structures that are surrounding the tooth. So there's many components, but most importantly, we have the bone, and then we have the gum tissue. And so when we talk about this branch of dentistry, like I said, we have the gingiva, and some of you probably have heard many times gingivitis, which means gums or the inflammation of your gums. We have the ligaments that are supporting the tooth, and then of course we have the bone. And so if you've ever gone to a dental office and they discuss with you that you have to see a gum specialist or a periodontist, this is what they mean. They mean that something is going on with the structures around your tooth, and you need to see a specialist because it's gotten to a more advanced stage. And so normally when you see your teeth, you see the gums, the root, and as you can see here in the picture, you see the ligaments, as I mentioned before, and the bone. Your gum should be a nice pink color. It shouldn't be red, right? But then in disease, as things progress, you start to see that the gum tissue is red. There's inflammation is what makes it red. And then you start to see the differences in the bone. And you see here the plaque and the tartar that's built up. So basically, once you first brush your teeth, immediately there's a layer that forms, and we call that layer biofilm. And over some time, plaque basically sticks to it as you eat, drink water, drink juice, and eat different foods. It forms into a bacteria that starts to stick on that biofilm. And over time, it grows and grows, and then it progresses downward between the tooth and the gums. And so we'll talk a little bit more in detail, but this is how it looks when it's healthy compared to how it looks when there's inflammation and your gums are red and bleeding, and then you've sustained some bone loss. So let's discuss the different stages. So we have the gingivitis, where you're aware of it before. You've probably heard it so many times, which is the inflammation of just the gums. And then it progresses to a mild, moderate, and a more advanced form and severe. So as I mentioned before, it starts off as gingivitis, and gingivitis is at the stage where it's reversible, right? So you haven't been able to maybe brush your teeth as well as you want to. You haven't gone to see a dentist in a long time. So now your gums are red, and every time you brush, you see that you're bleeding, or when you're flossing, you see that there's bleeding coming. And so you don't do anything about it, but at this stage, it's still reversible, because if you go to the doctor, the dentist's office, you can clean your teeth, and then things can try to go back to healthy. How our body works is that when something is going wrong, when there's something that's not supposed to be there, your body, or at least in your gums, the reaction is it starts to bleed. It starts to become inflamed in hopes of it trying to fix itself. So your body tries to start a process of something is wrong here, let's try to fix it, and it starts bleeding. But when it's neglected for some time, you start to see that the bacteria starts to grow downward between the tooth and the gum. As you can see here, between where this silver instrument is, this is where you see that the gums are bleeding and there's a buildup against the tooth. Now, oftentimes you'll go to a dentist's office and they may use some instruments and you'll feel this discomfort. You'll hear them calling out numbers like 1, 2, 3, 3, 4, 3. They'll be calling out numbers and you're wondering what's going on and why does it hurt? Normally, if you have healthy gums, it doesn't hurt. There's a kind of pressure that we apply when we're using this instrument. And if your gums are healthy, it will never hurt and it will never bleed. A lot of times some patients say, oh, I didn't feel anything, or I didn't have any issue until I used my instrument. And I always try to remind them that when your gums are healthy, they won't bleed when you're brushing, they won't bleed when you're flossing, and they certainly won't bleed when we use our instruments or our tools around the tooth. And so I spoke about the gingivitis where it's reversible, but then as you move forward into the different stages of periodontitis, you see that there's a lot of bone loss and there's inflammation of your gums. And here again, patients will say, oh, they came in, or sometimes they'll say, oh, me wahana, me sinu tuye, or me wahana, I said the tooth started moving. And it's like, why did that happen? And sometimes they say, oh, na me rina, me rika se bina, me sinu tuye. But it's really because several things had happened prior to that you wasn't aware of, or maybe you neglected, and that caused that to happen. The bone is what's holding the tooth in its place. So if you begin to have bone loss because of bacteria that has been there for a very long time, the tooth will start to move, right? And another thing that patients always complain about is, oh, when I was younger, now me see a fat, now me see a straight. All of a sudden, it's spacing in between, things are shifting and it's not the same way it used to be. And this is all because of periodontal disease, because the structures around your tooth have been neglected. You haven't been able to brush appropriately, or you haven't been able to go to a dentist's office to get your teeth cleaned. And now your body is reacting like, what's going on? Let's try to fix it. But while it's trying to fix things, it's causing more destruction, which is that bone loss. And so today I wanted to kind of discuss how this gum disease affects our systemic health. Because of course, all the time, people are worried about their body and they neglect their teeth. They don't think the teeth has anything to do with their body. But in actuality, it has a lot to do with our body, and even some of the conditions that we suffer with, if we were to reduce the bacterial load or the infection, the inflammation that was going on in our mouth, it would actually in turn help the systemic conditions that we're dealing with. And now there's a lot of research that's discussing it, but there's some conditions that are directly correlated, or you see that they affect each other directly when it comes to gum disease. For example, they've done many studies about Alzheimer's, and they found that those who are over the age of 70 and they've had gum disease for a long time, let's say 7 years or more, they found that 70% of them are more likely to get dementia. So if you're 70 years plus, and you've had gum disease for a while, if maybe it's gone undetected, and it's been 10 years, you have a 70% chance of getting dementia. That is a very, very high chance. We're not talking about 5%, it's a 70% chance. So you can see how it's very much involved. And so how this happens, you may ask, how is our teeth even involved with our body? So how it starts is you have this inflammation, and it's a localized inflammation, meaning it's only happening within your mouth. But as the bacteria continues to build up, as the bacteria begins to build up and it's been neglected, and your body starts bleeding within your gums, that bacteria basically starts getting transferred into your main bloodstream and into your body. And so if you can see here in this diagram, there's a lot of, big words and details here, but you can see how your bloodstream will be the connection from that bacteria within your gums and around your tooth, will go to all these different organs and have its different effects. Most importantly, they've talked about the bacteria within atherosclerosis, which is basically hardened deposits that are within your blood vessel. And this is when sometimes can trigger stroke. So they found that this bacteria, or this plaque that's within the blood has the same bacteria that's within your mouth. So that means that bacteria that you have in your mouth that has gone undetected for a very long time is now basically building up, is eventually found its way through your bloodstream and is contributing to that plaque within your blood that may eventually cause the stroke. So that kind of tells you, in short and just on a surface level, that if we were to reduce or control the bacteria within our mouth, then we won't be able to contribute to a certain level that bacteria that's within our blood that may eventually affect our heart, or it may even cause that stroke. And there's been many studies that have shown that with periodontal disease being an inflammatory condition, meaning it's an inflammation that's within our mouth, and you have conditions that are inflammation within your body. If you control that inflammation within your mouth, it can also control the inflammation that's within your body. And so one of the other conditions that there's been so many studies for when it comes to periodontal disease is diabetes. There's so much research showing there's an actual direct correlation that links the two together. And basically, when you have high blood sugar, which is diabetes, and you have that same level of sugar within your saliva, it works together and it causes damages together. It caused that inflammation that I was talking about to get worse. We find that a lot of the patients that have diabetes, when we do our treatment and they have uncontrolled diabetes and we do our treatment within their mouth, they have a hard time healing because there's so much systemic inflammation. But we find that once their disease is under control, their diabetes is under control, whatever we do in their mouth, we get way, way, way better results. So it just goes to show you that you definitely have to control your systemic conditions and then also control what you have going on in your mouth, because the two work together. So if you're able to fight the infection within your mouth, it'll also help reduce that systemic inflammation that you have going on that's also a part of the diabetes. And so a lot of studies that they've done, as I've said before, they've found that attachment loss, meaning basically the gums that are around your tooth and the bone loss, they found that patients who are diabetic and it's poorly controlled, it's hard for them to maintain that attachment. So they easily get attachment loss. Probing depths, that instrument that I showed you, when basically bacteria has basically seeped down between your gums and your tooth and has caused bone loss. The probing is the instrument that we use, and we call out those numbers. We find that patients with uncontrolled diabetes, they have deeper numbers, meaning deeper bone loss and more detachment from their tooth. And then again, poor wound healing, meaning when we do our procedures, like I said earlier, they don't heal well. And everyone knows with diabetes, even if you cut your toe, it can turn into a whole big deal. And it's the same thing that happens within your mouth. If we go in to do a procedure to kind of help control your periodontal disease, it will take a very long time for it to heal, and we may not get the results we want. So ultimately, it's important to control your diabetes and also control what's going on in your mouth as well. And so the effects of diabetes, of periodontal disease. So we see here on one side, we see the gums is covered. Meaning the gums have receded or have gone back away from the tooth. And when this occurs, it's mainly because of poor hygiene and that plaque, that bacteria that's accumulated against the teeth. And there's many other reasons that may cause the recession, clenching down or grinding down your teeth, meaning you press down like right on your teeth, or there's more your two teeth forces against the two teeth top and the bottom, forces against it, and that can also cause the recession. But most of the time is mainly because of plaque that is around your gum line that's causing it to recede. And so what happens is, as you lose bone because of that bacteria, you get a lot of your gum tissue moving back as well, because your gum tissue likes to stay very close to the bone. So the more bone loss, the more your gums are going to push back. And so if you are to have this issue where you have this recession, there's many ways that we can take care of it. But most importantly, you want to make sure that you get your teeth cleaned first before we do any other procedures. But if you feel like your teeth are long, as in the picture on the top, you see that the tooth is very long, you see the crown, you see the roots, and you want to get that covered. There's definitely procedures that we can do, like gum grafting, and that will help you regain that tissue. But it's important that you haven't neglected your teeth to a stage where there's so much bone loss where we're not able to take care of it. Now, this picture might not look nice, but I see these type of patients all the time. All the time, I see these kind of patients. You see their gum tissues is red, and you see the plaque that surrounded the tooth, and they also have many cavities. That black that you see is also cavities. And so a patient like this will often come to the office and they'll say, "Oh, doc, I only want teeth whitening." If you see some teeth like this, how can you do teeth whitening? There's so much that's going on that we have to take care of. Some of the teeth, they're just holding on because of the plaque has been there for so long. It's gotten so hard that it's just holding on to the tooth. But the moment we start cleaning off all the plaque, you'll start to see that the tooth is shaking and it's not strong. And so you may have had experience where you went to the dentist and you thought your tooth was stable, but then after the dentist, you're like, why is my teeth moving? And it's because the plaque that has hardened over time, it's called tartar or calculus, is now all gone. And now there's nothing supporting your teeth. So it's important that we make sure that we don't get to this stage. And it's important that, especially with our children, that we take it very serious. They go to the doctor's office. There's so many wellness visits when the child is born. And then afterwards, we neglect to take them to the dentist, or we don't take them at all. But a lot of times the schools now, they have systems that say, go take your child to your dentist and report back so we know that everything looks good. And it's because it's important. You don't want to have your child dealing with, tooth pain, or having to deal with eventually having bone loss around their teeth because their mom never took them to the dental office. That's no longer going to be an acceptable excuse, because we're now more aware of the importance of going in to your visits. And so let's just say, things didn't work out for you. You're now an adult now, and you weren't able to maintain going to the dentist often, and you've sustained a lot of bone loss around your teeth. There's ways to go about it, and ways to get you to a more stable stable health. And we call this procedure osseous surgery. And osseous stands for bone. So basically what we do is we go in, we move the gums away from the tooth so we can see it directly. Normally, you may have gone in for a deep cleaning. And with the deep cleaning, we go in with our instruments blindly. We're not able to really see. We just use the touch and feel against the tooth to clean away all the plaque and the bacteria. But if it's gotten to a stage where there's a lot of neglecting, then we have to kind of move the gums back so we can see everything directly and take care of it. So if you can see here, we have the steps of the osseous surgery, the bone surgery. The first step is us moving the gums away and assessing the bone. So we clean out everything that's there, all that infection that's between the gums and the tooth, and then we reshape the bone. Because now, after the disease has had its way, the bone has a very unusual shape, and it's hard for the gums to rest against it. So we shape it up so it's nice and smooth, and then we suture it back against the tooth. So now it's laying nice and flat against the tooth. And now you don't have that pocket that I was talking about anymore, where when we use the instrument, it goes very deep. Now that has been eliminated. Now you can actually clean that entire tooth surface because you can see it clearly. It's no longer covered by diseased tissue. As you can see at the end picture, the tooth looks very different from the before surgery picture. And so again, this is some of the results after the procedure is done. You see that the patient has very inflamed gums and we were able to clean it out completely. And this was the end result. Now it's up to the patient to maintain going to the dentist every 3 to 4 months to make sure that they keep the area clean. Now, this condition here is not only because of neglect of them not going to the dentist, but it also has to do with some of the medications that this patient was taking. So it's important to find out if you see that you have your gums has overgrown in such a way where it's blocking your tooth and it's hard for you to clean. Find out if there's any medications that you're taking that is causing that. Because once the patient stops taking the medication, you'll see that their gum tissue will return to a more healthier state. And so we always say prevention is better than cure. So how do we prevent even getting all the way to that periodontal disease? Because again, gingivitis is reversible. So if you find yourself in that case, you can get it taken care of and you don't have to worry about your bleeding gums. So clean your teeth twice a day. Every morning when you wake up and at nighttime, you brush your teeth. I have many patients, believe it or not, they can come into the office and say, oh, I forgot to brush my teeth. Like, I've been so stressed out, I don't have time to brush my teeth. That should be the first thing that you do when you wake up. You need to brush your teeth. There shouldn't be, I forgot. Even if you're running late, it only takes 2 minutes for you to effectively brush your teeth. So that should be something that you're able to do. And sometimes people even have toothbrush and toothpaste they take it to work with them so they can brush after lunch. And so it's very important that we take brushing our teeth seriously. Sometimes with the periodontal disease, the patient may have a very bad smell coming from their breath. But whenever you can be in a room with the person and when they talk, the smell of their breath can take up the whole entire room. Why is that? Because there's so much plaque and bacteria sitting on their teeth, and that bacteria can actually smell like sewage, right? So we have to make sure that we remove that plaque all the time, right? So that it doesn't build up to the point where it starts to cause a smell. And a lot of times when that happens with the patient, they themselves don't smell it, but everyone else around them doesn't smell it. So my mom is like, hey, what do you do? And I said, if you sitting next to someone and you could smell something coming from their breath, then, and Nwana said, you say, oh, sister, what you jigumwe, or you give them a mint or something, not the mint, no, or the gum. So the person doesn't feel, awkward about you offering them gum. But that's a way for them to, take care of that smell, or help everyone in the room that's suffering from the smell. But in other words, it's hard for you to really tell the person said there's a bad smell going on. So to prevent you having to deal with that, or you having someone deal with that, it's important that we brush our teeth twice a day, and we also floss our teeth, and we make sure that we go to the dentist. And so flossing is the most important. We brush everywhere around our teeth, but what about in between? In between has all that plaque that we removed from all the other surface still in between there. So it's very important that we use our floss and we clean out in between every single tooth, especially after meals. A lot of our meals have a lot of meat and just things that can easily get stuck in our teeth. So we have to make sure we remove that thoroughly. And once we floss often, you'll notice that the bleeding will stop. A lot of times, people that don't floss, their gums bleed all the time. Or when they're flossing, they say, oh, every time I floss, I bleed. So they stop flossing. But it's actually better for you to continue flossing through that bleeding. And then eventually you'll start to notice that your gums don't bleed. Your reason why the gums is bleeding is because something is there and your body doesn't like it. So it's reacting in that kind of way. And so sometimes we have spaces in between our teeth that are too large. And so food gets stuck in it. Every time you eat something, you'll say, this part of my tooth, every time something gets stuck in there and I can't get it out. Even sometimes when you use the floss, you have to use it repeatedly in that area. So in those areas, you want to use tools, what we call interdental brushes, and they look sort of like this. There's many brands that you can get this, and they come in different sizes. So you find the correct size that fits in between that area that's causing what we call food impaction. So the food has gotten stuck in that area. So you want to use the brush to get in between there and brush it out. And you see that it will brush in between the two teeth, and it will get into that curve that's in between there. Because floss is too small to clean that out, you need a brush to kind of get in between there. So you find the size that works for that area, and it shouldn't be that you have to jam it inside. You should easily be able to go through a little bit of resistance as you brush it and then come out. So you don't want to use something too skinny where it's floating in between, and you don't want to use something too big because then you'll cause trauma to the gums in that area. So you want to use the correct size, and you just find different sizes and you try it and see which one works best. And that can really help make all the difference, especially with those who have areas that can cause food impaction. And so I just want to briefly discuss the topic of replacing missing teeth. You may have found that, okay, now there were some things that didn't go well. You weren't able to maintain some of your teeth, and now some of your teeth had to come out. What do? It's very important that you don't just leave your teeth like that. Some people, once their teeth come out, they just leave it, but it actually causes many other issues when you just leave it and you don't replace it, okay? It can also even affect how you look. It can make you age very easily because what happens is when your teeth grows, the top grows and then the top one grows and then they connect with each other. And that gives you that dimension of your face, the shape of your face. Now, if you have missing teeth and there's nothing for it to bite down on, if you have several missing teeth, it can mess up with the length of your face. You can start to see your face gets a little bit long, gets a little bit drooping, and you start looking older, all because you have missing teeth. But notice when you replace those missing teeth, you start to look a lot younger. So here are some of the options for replacing missing teeth. So the first option, most patients like to go for this because it's the most affordable and it's the easiest, but it's not the most comfortable, especially for someone that's younger. So they call it removable partial denture. It will replace all the missing teeth, but you have to take it in and out every night. You can't leave it in at nighttime. So that's the first one. The other one is what we call a fixed bridge. And so let's say you have one single missing tooth. They'll replace that missing tooth with a tooth that's floating, as you can see in the picture. And then they will put a crown on top of the two teeth that are next to it. The only thing with the bridge is that sometimes if the two teeth that are next to that missing tooth are healthy teeth, you have to shave it down in order to put a new crown on it. And sometimes you don't want to do that. So then the ideal way to replace one single missing teeth will be for you to get an implant. Now, implant is a little bit or a lot more expensive than you getting something like a removable denture or a bridge, but it's something that will last a long time and you can maintain your healthy teeth that are next to it. And then for those who have completely missing a lot of their teeth, and believe it or not, the age of people missing a lot of teeth is getting younger and younger just because people are not are neglecting their teeth and they're not going in for their dental visit. So for those who may have several missing teeth, you may already have a denture. And you may find that sometimes the denture is uncomfortable for you to wear. And sometimes when you're talking, it may come out or it's discomforting. You feel like you don't like wearing it. Well, there's ways for us to stabilize that denture within your mouth, and it's with implants, and they call it a implant supported overdenture. And basically we place implants in select areas in your mouth and the denture will snap on. So now you'll find that the denture is snapped onto something within the bone and is holding onto it. So it's not just your gum that's supporting, it's not just your gum that's supporting the denture, you have your bone within with that implant that's supporting it fully. So when it comes to denture, one of the things that's very important, as I mentioned briefly earlier, is you have to take it out at nighttime. And the reason why you have to take it out at nighttime, I know it's you know, maybe a feria woman, or you just feel like you want to just keep it in, or even sometimes it's just basically laziness to keep it in your mouth. But you have to make sure that you take it out every night, because what happens is the denture is attached to your gums and the bone within it. And all that pressure that you're putting putting on there, your bone will start to resorb, or it will start to reduce. And then that's when you start to see that the denture fit really nicely before, but now it's not fitting well because you're not allowing your gums and your bone underneath to breathe. And then also you will find that if it's an area where bacteria can hide. So you want to be able to take it out, clean out your mouth without the denture in it, and clean the denture itself at nighttime so that that bacteria doesn't build up on it. Believe it or not, bacteria does build up on the denture. If any one of you have a denture or a removable partial denture, you'll see that you have to make sure that you brush it because things get stuck on it. Plaque builds up on it the same way that it builds on your teeth. So you have to make sure that you take it out at nighttime, allow your mouth to have a bacteria-free moment to rest throughout the night, and then you put it back on in the morning. And there's solutions that you can soak the denture in so that it doesn't build up. And then you rinse your mouth and then you go to sleep and you put it back in at nighttime. In the morning time. So again, briefly, visit your dentist regularly. If you've already suffered from periodontal disease, you want to go every 3 to 4 months to get your teeth clean. So instead of the 2 times a month, you may end up going 4 times. 2 times a year, you may end up going 4 times a year. And your insurance may cover 2 times, then you have to may have to come out of pocket and pay for the other 2 cleanings, but it's worth it because what happens is that, and the studies support this, the research support this, that if you don't clean your teeth every 3 to 4 months, that bacteria is going to build up again. And so you have to make sure every 3 to 4 months you disrupt that process, you get your teeth cleaned, and then you start over again. So you don't go all the way back to that advanced form of periodontal disease. Clean your teeth twice a day, brushing, flossing in between your teeth. Control your diabetes. Like I mentioned, diabetes is basically one of the diseases that really affect our teeth. So it's very important that we control our diabetes before we get any dental treatment, and we make sure that we stay on top of our condition. And then, of course, eating healthy foods and not smoking. I know smoking is not something that we suffer with, but eating healthy foods so that your your gums can stay in a place where it's not so acidic and you're able to have a balanced pH within your mouth, so it's not so prone to bacteria buildup or plaque buildup. Okay. So I hope that I know I didn't speak that much and it's a new language when it comes to dentistry, but if there's any questions, I'm happy to answer all of it.
Amen. Amen. Thank you so much for this wonderful presentation.
Amen.
Pastor, you will there's 10 minutes for questions. So what question Biana what Jones Anna Webisa. Okay,
Hello?
Dr. Adjuman, yeah. But you're waiting, Akasa.
Okay.
Okay.
Salome,
Doctor, yeah.
My question, okay, say a neuro bio, say, yeah, see, and I gum no. A neuro bench, Abia, a bit to me, I train who are free. Now, a new name so be a and so to me say, yes, and I gum no.
I'm sorry, but I think that question, Busano, it kind of cut off. So maybe it's me, but I didn't hear the question fully.
All right, my main say repeat. You make I say, okay, say, neuro bio, it to me say yes, and I gum no.
Yeah.
A neuro bench, be a movie for be a bit to me, I train who are free. Now, apart from in neuro, in your name should be a say yes, and I gum.
Okay. Yeah, so there's certain medications that patients use for if they have seizures, those type, there's a list of medications, they call them anti-convulsants. There's a group of medications, phenytoin, there's it's a group of anticonvulsants, so medications that patients may take for seizures that can cause your gingiva to or your gums to overgrow. There's also medications for immunosuppressants, patients that have cancer. They take a set of medication that can also affect their gums. And then there's also a group of medications called calcium channel blockers that also cause your gingiva to overgrow. So if you see that that's something that you're happening, you can ask your doctor, is any of my medications within like an anticonvulsant? You'll know, or is it a calcium channel blocker? You'll know, and then you can go to your dentist and let them know. Once you go to the dentist, you have that, and they go over your medical history and the medications you're taking. They'll be able to immediately tell you, oh, this is the reason why that is occurring. And when it comes to food, there really isn't any food that affects your teeth. But when it comes to food, is the frequency of it. So you can't eat candy at all times and not take any break, or you're always constantly eating and not taking any breaks, because you need your mouth to go into a basic pH. You don't want your mouth to continually be acidic, because once it's acidic, that's when the destruction happens. So you want to be able to maintain a more balanced pH. So taking breaks when you're eating so that your body can return to a less acidic environment. And then also at nighttime, the same way when you're resting, it's not as acidic, and so that your body can kind of reset.
Actually, Dr. Sarah, obetumi abisa question.
Thank you so much, Dr. Salome, for the presentation. I have two questions. My first question is, I've always been told two competing things, that the best time to brush your teeth is before you eat, or the best time to brush your teeth is after you eat. Can you please shed some light if that really matters? And then the second question I have is for people with sensitive teeth. Is there any techniques or things we can do to avoid the tooth sensitivity, or is there a special toothpaste that you recommend for preventing or even reversing the teeth sensitivity? Thank you.
Okay, so when it comes to sensitivity, the toothpaste that is best to help with that is Sensodyne toothpaste. But the trick with using Sensodyne toothpaste is, once you brush your teeth with it, you have to avoid rinsing it out. So most of the times when we brush our teeth, we immediately rinse with water vigorously and then spit it out, right? So now all the properties of the toothpaste that you put on your teeth has basically been rinsed away. So you want to make sure once you brush with it, you just spit out whatever is excess and you let the toothpaste actually stay on your tooth as a paste and let it absorb into your tooth. And that will really help with the sensitivity. And that's how they've studied the toothpaste. You know, the research they've done on the toothpaste, that's how it was done. They put the toothpaste on, they didn't rinse it out with water, and they let the paste absorb into the tooth. So that will really help with the sensitivity. When it comes to brushing before or after eating, it doesn't really matter. I mean, is your question more so in the morning when you first wake up, should you brush your teeth, or can you eat, then brush your teeth?
Yeah, that, like, as some people have told me, it matters if you eat before or after. So I was just like, I don't know.
It doesn't really matter, honestly. The whole point is making sure that you remove that plaque that's going to build up from what you just ate. So honestly, it will be best that you brush after every meal. That's ideally what you would want to do. Brush after every meal if you can.
Ish. Okay.
Well, yeah, but you want to do it 2 times, but if you eat something midday and you are able to brush, it's good to brush, especially if you're more prone to decay or cavities in your mouth. You want to make sure you're always disrupting what's going on there so it doesn't build up on your teeth.
Dr. Salome, na Dr. Sarah question no. Part back one or say again the cause sensitivity no. And son or the toothbrush toothpaste in the anybody who wants a toothpaste in the a course on the one can't stroke. I don't mind.
Okay, when it comes to sensitivity, it's so many things. Sometimes we use toothpaste that are too abrasive on our teeth, meaning it's too harsh, it's too rough on our teeth. a lot of the toothpaste that say, oh, it does whitening, it has things in it that strip the teeth away. So whenever you're using it, it exposes, basically the idea is for it to expose your teeth so that the whitening can go inside and basically make it white from the inside. So when that happens, your teeth is constantly always being, like the rough properties of the toothpaste is always rubbing against your teeth, and now it's making your teeth very sensitive. Other things can be a cavity that's on the tooth that's coming off as it being sensitive. So you see that when you drink cold water or you eat something sweet, not acid, and that sensitivity is because of the cavity that's there, meaning there's some bacteria on your tooth and your body is reacting to tell you that something is wrong here. And that's why I'm showing you that I'm sensitive.
Pacho, Edru, Auntie Abna, so Abna.
Thank you. Thank you for your presentation, Dr. Salome. I had a question regarding water flossing. What's your take on that? Because I've seen it gaining popularity. Is it effective, or is it better to just stick to the regular flossing?
I will say the combination is good. If you remember earlier in my presentation, I talked about the floss and I talked about the interdental brush. So those areas where the space is big and food gets stuck in there, when you use the water pick, it basically flushes the water in between there and cleans the plaque out. But it helps with big spaces. But if you have tight spaces in between, you want to use the floss to rub against the tooth. So a lot of times when we're flossing, we just go in and out like this, and we don't pick up and out what's in between our teeth. So with flossing, you want to put the floss down and make sure it's surrounding in a C shape around your tooth, and you go up and down and you pick up and out whatever's in between. It's not going in and out. So the water pick is good. I think it's good to add, but I won't say completely not use floss and only use the water pick. I think it's good to use both, and the water pick is good in, those areas where you can get food stuck in.
Thank you.
Auntie,
Okay, with that said, Doctor, thank you for the wonderful presentation. My name is Awoya, and I have two questions for you. First question is, why dentist is so expensive for us not to go? Because within our body, you can go to the hospital for anything, but the dentist, it's not easy. No matter what, you have insurance, it's not easy. It's too expensive. Why? And the second question about bad breath. My sister is also a bad breath. Now, recently, my church member will be now or get too closer to my pastor. My pastor and to me anchor. But you can say, I'm going to and a lot of people know the person I'm talking about, but I got the opportunity to go to pulpit with him. So when I got closer to him, he opened his mouth. I almost ran away from the pulpit. So I whispered to his ears, I said, please, brother, when you go home, use lemon to soak your mouth. I said, okay. Now, I'm so be but now, I said, a pulpit is Sabbath. And Tim who say, I believe so. Yeah, they say, oh, bound change, swat kakra. And lemon, I work here and now say, and work it. And now say, dainty, why the guy is spending, but me, theory, and say, see, it's me, I read, it's not perceiving him. It's me two questions. I don't know. Thank you.
Okay, can you remind me the first question?
The first question is so expensive to go to the dentist in this country. Very expensive. And why? That is so expensive than anything that procedure you would do to your body.
Yeah. So that one, I don't have a true answer for it, but I know that it was very expensive for us to gain our education. And so when it comes time for us to pay back the student loans and everything that we lost from getting our education, somebody has to help us get along. So it affects the patients. I mean, that may not be the true reason, but I can't really give you a true answer why it's so expensive, but I know it's a thing, and insurance seems to not cover a lot when it comes to that, and they focus mainly on our health. I think if more people speak up about it, maybe something can be done, but I can't really speak to the true reason why dental insurance doesn't cover much, or why it's so expensive. And so the other question about the church member who was struggling with bad breath. When it comes to bad breath, sometimes it's a combination of things. And sometimes that bad breath can be because of maybe the person may have been having a sinus infection that is coming out in the smell of their breath, or they have some condition that is causing bad breath. I have a whole PowerPoint or topic just going into the details of bad odor or bad breath, but there's many health conditions that manifest itself through your mouth. And so your mouth starts to give off this bad odor because of the certain condition that you have. Diabetes has a smell that your breath gives off. Many conditions have certain cancers. They all have certain smells that your breath gives off. And then on top of that, if you add having periodontal disease, and that bacteria and plaque that's within your mouth is also gonna give off a smell. So it could be many things that was causing that bad breath. With the lemon, there's no study that truly says lemon helps with controlling bad odor, but it could be that they were paying more attention to their teeth after the conversation that you had. And so they were doing more things to to help. That's the only thing that I can tell you. But when it comes to lemon, there's no true study that says lemon really, helps with your teeth. If anything, I think lemon may not be a good idea because it's very acidic. And like I said, you don't want your gums, you don't want your teeth to expose to that kind of acid, right? So lemon may not even be a good idea to necessarily rinse with. But again, it could be a condition that the person had that was manifesting in him having the bad breath.
Okay, thank you, doctor. I appreciate it.
I'll send my team answer.
Me da se ba dentist buona na ya monte so kakra ma yen na yen ti me betutu yesen. Thank you so much.
No problem.
Me pacho ase omo peja omo Dawson ti Elder Beckwin pacho betimi ama a few minutes bi aka time ho.
So I just want to answer some of the questions in the group chat. First question is toothbrush. What recommend? I recommend soft toothbrush. If you have hard toothbrushes, throw them in the garbage. Only soft toothbrush. It's not how hard the toothbrush is that will brush your teeth appropriately. It's your technique of how you're brushing it. So you focus on the area that you're brushing one side at a time. You clean it and then you move on to the next. But only soft toothbrushes. What age do you start brushing kids' teeth? As soon as they have their teeth, you brush their teeth with you can, when it's just a few teeth, you can still continue using a washcloth and warm water to clean inside. But once they have 2 or more teeth, you can start using the toothbrush to clean it, especially if they're drinking milk at nighttime and eating more foods. You want to make sure that you get that food off their teeth. And then eating ice. Eating ice isn't good. It causes small fractures within your teeth. And the same thing with bones as well. When you bite down on those bones, it can cause fractures on your teeth. So avoid biting down onto things like ice and bones, at least not repeatedly. Remedies for halitosis. So when it comes to halitosis, again, I have a whole PowerPoint on halitosis, but we have to find the reason why you have the halitosis. There's many reasons why you have the halitosis. So there isn't one medication or another that will fix it. We have to get to the source of what's causing it, and then we'll be able to address it. So if you feel like you suffer from halitosis, it's just a matter of going to the dentist and saying, you know, doc, I have this bad odor. I don't know what's causing it. And once we do our treatment plan, we'll be able to figure out what's causing it. And another thing to mention is make sure you brush your tongue, because the tongue harbors a lot of bacteria, and that can also cause bad breath as well. Is fluoride toothpaste truly toxic? No, fluoride is not toxic. It actually helps your teeth get remineralized. So as your teeth are breaking down, sometimes if you have a cavity that's forming, if you use toothpaste that's high in fluoride, it can actually reverse that cavity that's forming. So fluoride toothpaste is not toxic, and I recommend that you actually use toothpaste that has fluoride. If you're using toothpaste that doesn't have fluoride, it's not really helping you. You must have fluoride within your toothpaste. Charcoal to clean your teeth. Charcoal, again, is one of those abrasive ingredients within our toothpaste that eventually cause sensitivity on our tooth as we keep using it. So I would say if you have charcoal, yes, it does whiten your teeth after several uses, but you want to make sure that isn't your primary toothpaste or the primary thing you're using at all times. You can use it, maybe there's occasion coming, then you can use it every day to get your teeth whitened for that time, but it shouldn't be every day you paste with charcoal. Is teeth whitening safe? Yes, teeth whitening is safe, but again, you want to make sure it's not something that you're doing repeatedly because of the sensitivity. So if there's occasion, you do the tooth whitening, and then you and then you take a break, and then you go back to it again. Since my fluoride ingestion, I have tolerance. Oh, okay, so with the toothpaste, you want to make sure with children you're using toothpaste that's for their age. So every age, there's a certain toothpaste. So with kids, we know that they can't spit out the toothpaste. So the fluoride content within their toothpaste is enough for them to swallow. So you don't have to worry about them getting any toxicity from swallowing the toothpaste, because the fluoride in there is enough. And again, when you use the toothpaste for them, you have to use the size of rice. A small grain of rice, that's how much toothpaste you have to use, nothing more than that. So if they use that small amount, then you shouldn't have to worry. But if you're using a lot of toothpaste, then you may need to dial it back. For a rice grain, and for adults, you want to use a pea size. So size of the vegetable pea, that's the size of toothpaste you want to use. Okay, so that was all the questions in the in the chat. And there's some hands raised. I don't know what.
Pacho, Elder Becker was so.
Pacho, when they patre na umunsa also musa question ya family.
Okay, thank you. Pacho, V Betty kind akasa na Auntie Gladys na iPhone. I last person or baby sa question.
Okay, me that's bebree. The question is say, ubedi who good dentist no wakona ho. The nti ameka sa ne say 2019 corona brand na me koye before the corona, during that time na me koye feeling. After doctor ne say 4 months time bra. Me koye o ye feeling ni wie ya wasan really ho wo baby. And no feeling. As was if 3 weeks bra. Me kwaya wasan aye we bi say me ye crown and all the crown share crown nya infection if you come meeting by penesin specialist after me see me two crown na me sanye no for me ko am insurance no they don't pay for it. And yes no me ko bio no see me two na me say community for problem because they say no what really hold what top because oya mess no oya one what top bibia hia say oya wo ho nti hole ne da ho wɔ hɔ bɛpem de because mempɛ sɛ mɛkɔ ne ho biom nti about 2 years menkɔ ho dentist because mesuro sɛ mekɔ a obi foforɔ nso bɛmɛse me sene up because baabi a ɔdrele hole no problem biara ni hɔ ɛyɛ feeling pɛpɛ na ɛsɛ meyɛ wɔ aseɛ ɛna ɔkɔ dele wɔ so nti sɛ ama mesuro sɛ mɛkɔ akɔhu dentist at the same time hole ne da wɔ mepɛ sɛ mefeel nti wowɔ suggestion bi a wobɛyɛ a wobɛhu because wei no madamfo paa na recommending no ɛma so we'll end up asking.
Yeah, I was going to say some of the best ways to find a good dentist is through recommendation. Yes, if someone you know has gone to that person and they really enjoy the service, then you can go to them. But if not, it's good to look up reviews about the doctor and just see what different people have been saying about their experience there in order to decide if you want to go to that office or not. But I think what's important is that when you go to the dentist and they're discussing with you what you need to get done, I think it's important to have them explain to you, why do I need a filling here? Why are you suggesting this treatment? Why do I have to go to a specialist? Have an understanding of what they're recommending so that you know what's going on. So it's not like, oh, Ofitiana, he went to drill the thing here, or why is he doing that? Was it a mistake? You know, so that way you could keep track. You know, they'll give you a treatment plan. They'll say tooth number, so-and-so needs this. You need to do this with this. And they will explain it all to you. Say, no, then you look at the treatment plan and you ask them, okay, why do I need this? Why does this tooth need a filling? How many teeth I need, how many teeth do I have that need a filling? That way you can know that, okay, today you came, you did 2 fillings. That means you have 3 more teeth left. So, or, you know, you just keep track of the treatment plan that they've given you, ask all the questions before you move forward. On the day that you have an appointment, you make sure that you know what the treatment needs are, because they let you sign a consent saying that you're going to do such treatment. So you have to know what's going on. Sometimes root canal, you can have a crown and they may do a root canal on top of that crown. They'll drill a hole within the crown to do the root canal. So there's so many different things that might have been going on, but they may have not been able to explain it to you appropriately, or you wasn't able to ask all the questions that you wanted to. So make sure before you move on with any treatment that you take your time to understand what the treatment needs are, so you and the doctor are on the same page. And if you feel uncomfortable with the doctor about what they're doing, you could tell them to stop. And at any point they can stop what they're doing, cover up what's going on, and you can seek a second opinion, you know, to treat the condition.
Okay, because when the top on a problem near be any home, it's a mess, no mess on messing top. I mean, no mess, not the bottom part. Because
so I would say
bottom no dentist back, which let me say I need a filling, but that dentist no, I'm a regular dentist no, or close to it. Will be recommended we are a but at the same time, that's
yeah, I would say if you feel like you want to really know what's going on, get your previous x-rays from that doctor and see what happened, the tooth that they touched. Maybe there was a cavity, maybe there wasn't, but you want to make sure you have that doctor show you said, this is the reason why I did the filling, because not x-ray, no chest said a cavity will hurt, so that's why I went there. That way you could feel comfortable to know, say, okay, that's why the doctor touched that too. And if there's nothing there, they can't prove that there was nothing there, then, you know, that's a different story. But I would say, find out with the x-ray to see what was going on before they even touched the tooth, and, you know, why was that the treatment they decided to do.
Thank you.
Auntie Gladys,
okay, yeah, thank you, Dr. Salome. I have 2 questions. My first question is, what is the color-coded toothpaste? You know, every toothpaste has like a color-coded at the bottom. Can you explain to us why? And is it better to use the natural toothpaste? Because I know it says natural and fluoride free. Because I know you just spoke about fluoride, but I know the natural one don't have fluoride, and somebody said that was the best one. And my third thing is about wisdom teeth. What causes the pain that you have to take your wisdom teeth out?
Okay.
Thank you.
So when it comes to wisdom teeth, what causes that is our mouth over time has gotten very small. And so what happens is when the teeth are coming in, and this is not for everybody, but for most people, when our teeth are coming in, they're when our teeth are coming in, there's not enough space for it. So that's when they say, oh, your wisdom teeth are impacted and they have to come out, because what happens is it starts affecting the teeth in front of it because it's pushing against it. It's trying to find a way out, but it's not able to come out. And then it causes damages in the teeth in front of it. So you want to make sure that if that's the case, that you get it removed. And when it's coming in and pushing against the teeth in front of it, that's when it's causing that pain. And then bacteria is getting stuck in there because it's halfway out, but not all the way. And the gum tissue's covering it. So it's just a lot of things that's going on there. And if the doctor ever recommends for you to get the wisdom teeth taken out, you're not losing your teeth.
Okay.
The wisdom teeth are teeth that are not in function. You're not biting down on it to eat or anything. So when it's gone, you're not losing out on anything. So that's the question with the wisdom teeth. The second question was the different codes on the toothpaste. That's a good question. There's different reasons for the different codes. I think blue on the toothpaste may mean that it's a natural toothpaste. And I think red is also natural as well. And green is also natural. So there's different reasons for the the different colors on there. I think there's blue, red, green, and then there's also a black. And I think black means that there is chemicals, and red may mean that it's a combination of it being natural and some chemicals, and green meaning it's all natural. So that's what that means. But when it comes to fluoride, natural toothpaste, most dentists aren't going to recommend you to use a natural toothpaste, right? Because you want to have that fluoride in order to remineralize your teeth and help against cavity protection. So if you're using a natural toothpaste, it's fine, but I think you need to make sure that you're getting the fluoride from your toothpaste. Or you can also find out the water system in a lot of communities have fluoride, have a certain level of fluoride in it. So if your system doesn't have any fluoride, then you have to make sure that you're getting your fluoride from the toothpaste. But if it's within your water, then you can continue to use the natural toothpaste, but I think you should still add a fluoride toothpaste.
So out of all the lot of paste that is in the store, which one do you recommend? I mean, Crest or Colgate, or which one do you recommend the best?
So honestly, it's not really the toothpaste itself. Yeah, if you have sensitivity, I recommend Sensodyne toothpaste, or even any toothpaste that has anti, sensitivity properties in it. You could go ahead and use it. It's mostly how you're brushing your teeth. So the toothpaste doesn't really help with removing the plaque. It's just it has those properties like the fluoride that help with the cavity, that help your teeth, but but it's mainly how you're really brushing your teeth. So you can use any toothpaste. Some people Crest works for them. Some people Crest does. Like when I use Crest, my teeth are so sensitive I can't even use Crest toothpaste, but for someone, Crest toothpaste it works very well for them. So with the toothpaste, it doesn't really matter to me as long as it has fluoride in it. That's what's important. And if you have sensitivity, you can use Sensodyne toothpaste. It's highly recommended, but you can use any toothpaste that says, they help with sensitivity, and see which one works best for you.
Thank you.
Yeah.
That's your iPhone.
Okay, that's it. Salome, the question here, say, only say your Africa and Ghana per se, yes, say breastfeed for so long, it causes decay for our kids. How far is true? Secondly, we have a traditional way of brushing our teeth. What do compare America there no? We yes we cavities, yes we will be by Ghana, like Yanyasa, you used to chewing stick. What do you call it? Charcoal and a hard brush, and then the brush it is like yes, but teeth problems as compared to American, but and also how can you advise us from our traditional way of brushing our teeth, any American way of brushing our teeth? Yes.
Yeah. So the first question, sorry, what was the first question again?
First question here, say yes, say who breastfeeding for so long.
Yeah.
It
Yeah.
will cause so decay.
Yeah. So when it comes to breastfeeding, it's not the breastfeeding that's causing the decay, but what happens is that once the child finished drinking the breast milk and they go to sleep, the milk is just sitting on their teeth. That acidic milk is sitting on their teeth, and then it starts to cause your teeth to go into a process of it breaking down. So it's important that once you finish breastfeeding and then the baby's going to sleep, you wipe their mouth so that the breast milk is not just sitting on their teeth. So you could breastfeed, there's no problem with that. You just have to make sure once the child has teeth, you wipe it before they go to bed so the milk is not sitting on their teeth and then it starts causing a cavity. The chewing stick used to take the place of you not having a toothbrush. So now that you have a toothbrush, you don't have to use the chewing stick anymore. The chewing stick doesn't have any properties within it that will help your teeth. It was just a way of removing like something rough that will help remove the plaque. One thing about Ghanaians or Africans, we don't suffer as much with cavities, but what we do suffer with is the periodontal disease. So even though you're brushing away the plaque that's sitting on top of your teeth, in between your teeth, you're not flossing it. So then you get the bacteria going down and cause the bone loss and everything I discussed about. So that's basically the issue when it comes to using the chewing stick. It's good to help prevent cavities because you're brushing around the teeth, but in between you're forgetting it because you're not able to floss. And then I think Senna, there was one more question.
Ghana say but you should brush it that, but in between because we are steak nibi now the afroso to the bia yet and also I say naturally we do duano everywhere we be we line be now the afroso I say no one yeah so obi anya tooth problem bia but it seems say nia ye no ha no if he said no ye papa ni nyina ye mfa se de no mienu nyina afra e betimi ayi nti obi ka se obi use brush fine so obi use brush no use to duano a oyi duano stick bi no de aye frost no and okay
yeah but honestly the stick is only going in and out. It's not going beneath the gums. So that's the idea of flossing, going beneath the gums and cleaning out what's going there. And the research has shown Africans suffer with periodontal disease a lot. And it's probably mostly because you're not cleaning down beneath the gum with the floss. So here I said they don't brush around their teeth at all, right? So then they get the cavities. But then in Africa, they're not able to get beneath the gums to clean it out. So then they start to get bone loss. So it's a combination of things. But if you don't have a toothbrush and you're using the chewing stick, that's your option at the moment, then it's fine. At least it's something that's cleaning your teeth.
Sure, yeah, time now so. Meda Dr. Salome Asepaye on behalf of Health Department. Say your tone safrel or anaya invitation. And mesan so ada Timmy joining line on so Asepaye. Nyamia adumo now see a better program na so. Dr. Amponsano obe lead a program no and obeka about maintaining healthy habits. Yes, almost more invite and for no soon be joining line no be. Now more questions and so embra. And then about 115 people and I joining line no. Na ye pe 200 but yen drew ho and yes almost say na muntini for amount for no be joining. Saturday so free health screening. Check it will BP no blood sugar and can ho empty. Start 8 a.m. Yes, some say invite obia say obia brand tem na yetimi close in tem. And I have free food empty. Only how cry. I think say enwano no. Enti yebema anti-vida abo ye closing prayer na mae. Na ya kamis pa na yeko.
My mom fire, but that's it. That was it. I got the four mobile for no done for a Japan crown as a day and I would dear. And you may saw the cool you must saw now a dear ba. Now when I'm Dr. Salome saw now if you watch church, the choir befa saw na yes, a beya a benya a hodine. Na into true a my in them. Na yet me ye a show already with men yam. That was it. Health for program de my na watri mu adesua emu edo na ebeboa ya ma ya setena etimi aye anigye ene enkwatenten ahye we urade odina nunyam ana oboshe abemoma ye enwumre the health department for no hye won sa Dr. Fia ene ne team se hira wo mo na waba wa ketwa Salome ode asem ibre nso urade hira no ne hira wasafo manyina ebra ye kwada hwe so a yeso bi ema asem adepachi ene esa asori a ede aseda kese ama odin eda wase kwan a wofa so eboa not bronze asafo ama asafo etumpo akoso programs ahodo a wode my radio eyi efe na eso ye ni ti eda wase wa ade nyina musa wo kan ye ho bedu sabre enunyam ka odin ye radio ni agenkwa Kristo Yesu ne konkon ne mo amen.